How do you see demand for PMI changing within the workplace?
So we're seeing a higher demand than we've ever seen before, more than perhaps anybody could have predicted pre-pandemic. And with that comes real opportunity for us as an insurer, an opportunity for benefit providers to really provide something valuable to their employees, but also a challenge to keep that sustainable. With that demand comes a whole load of work that we need to do to make sure that it can be sustainable. So it's a double-edged sword, but definitely we are seeing unprecedented demand for our services at the moment.
And what's the reason behind that?
So we think largely it's to do with some of the challenges in terms of accessing care through the NHS and people using private healthcare more than ever before. In our data, we find that actually people are turning to private healthcare that never considered it in the past. So it is very much that, but also an awareness of health and well-being post the pandemic, and therefore an awareness that actually keeping well, looking after your health and really getting that care when you need it is really important.
So we've seen this increased demand for PMI. So what should employers bear in mind when considering whether to introduce or even extend their PMI coverage?
So we would suggest to look at the data of your employee base, really understand what's going on with them, what their health needs are and where they would really drive value. That might be them and their families and their dependents, or it might be your workforce on its own. To really think about who you want to provide that care for, whether you want to go broad and offer something for a lot of people or go deeper in the coverage that you can do. And I guess my advice would be also to think about the sustainability of those benefits going forward. This is a benefit that you'll want to put in place for a number of years. So think ahead. Don't just think about the needs that you have right now.
And what are the key emerging health needs that AXA Health is seeing, and how do you think this will affect the workplace health in the future and now?
So we're seeing the same as you would expect across the industry, right? So a growth of mental health conditions post-pandemic. What's really interesting is we're actually seeing that come through a lot in gastro conditions and digestive health. So we're seeing a real rise in those claims coming through. It's hard to tell, but there's an assumption that a lot of that is actually down to stress and those kind of things. I think it's 1 in 5 individuals will take time off in a year for digestive health issues. So we're really seeing a growth in that area. We consistently see a growth in cancer demands as access to care in the NHS becomes more challenged. And then there's some pockets of some more specialised care that are really, really important for employers at the moment. We're proud of our neurodiversity service that we have to really help people to get through those assessments and understand what's impacting them at their ability to work and perhaps think in different ways. And definitely a continued focus on women's health issues, particularly fertility and menopause.
So there's been conversation for a number of years around digital healthcare and its connections to the workplace. How do you see this digital healthcare influencing workplace health and protection in the future?
So we ask our customers all the time about their attitudes towards digital health, and actually the response is quite consistent. They are really up for digital ways to access care, but it should never only be the only option available to them. So what we try and implement is what we call digital first, but never digital only. Our customers are really clear, it's their health, and if need be, they need to be able to speak to someone on the end of the phone. In terms of care delivery, we think it's an area that opens up some really interesting opportunities to protect that access to care. As an example, at the moment, if you've got a bad knee, we're trying to put you in touch with the best knee specialist near where you live. Actually, there could be a brilliant knee specialist that lives in the north of Scotland that doesn't have as many patients around you. They can review your information digitally, and we can put you in touch with the right clinician to get the right care first time. We also see an interest in terms of being able to collect the data about that patient in advance. So actually you can, in your own time, tell us what's wrong with your knee. Tell us all of the information about it. That's a really efficient way for us to deliver care because it means that our clinicians can review that really quickly, but it also gives you the time and space to really think about your answers, particularly if it's something that's impacting your life. So we think it opens up some really interesting opportunities to protect that access to care and deliver some really interesting patient outcomes. And that's something we're really investing in heavily within AXA Health.